Serious, doctors of Reddit, what was your worst? I don't think this is important, but patient. Had a male in his 50s walks into trauma to have his left thigh stitched up. Not an uncommon wound in an agricultural area. Speaking to him while stitching him up, he tells me he fell off a ladder while cutting a branch and the machete sliced him on the way down. Told him I was going to write him up for an x-ray of the entire leg just in case. He kept on saying he was fine. His knee hurt a bit but logically that was from the fall. Agreed. But asked him to go to the x-ray department just in case. He reluctantly walked there and back. X-rays showed a helical fracture almost the entire length of his femur. Besides being a dangerous fracture, the femur is supposed to be the most painful bone to break and he was walking around. In the end had to show him the break to get him to sit down on a wheelchair and into the hands of orthopedics. That man's pain tolerance still impresses me. Everyone at my company knows the story of the patient who came in for genetic counseling, went through their whole family history with the counselor, and then concluded with, "Oh yeah, I was adopted as a baby and don't know who my birth parents are. Does that matter?" Me. Any prior surgeries? Patient. No. Me. Examining them. Did you know that you only have one testicle down here? Patient. Oh yeah. I had one cut out. Question mark. I always asked specifically about gallbladder, appendix, and testicles because patients forget about having a organ cut out. One of my first patients as a medical student, we were asking her about prior medical history. BC she was in a waitlist for an intestinal transplant, and we asked her in every possible way if she had any history and she was like, no, I was very healthy before this. Finally we ask her, do you take any medications at home, and she goes, oh, just the meds I take for the lupus. Me. Do you have any medical history? Including things like heart attacks, strokes, high blood pressure? Patient. No, nothing ever. Me. So why do you take list of heart meds? Patient. Oh, I've had multiple cardiac arrests. Had a guy in his 50s who had been seeing an acupuncturist for an area of numbness and weakness traveling down his legs. He'd had 2 months of acupuncture for them with no improvement, so very reluctantly booked a routine GP appointment. At that point he'd started to have issues with his urination too. As soon as I started speaking to him, it became obvious that the symptoms he presented with were consistent with spinal cord compression, an absolute medical emergency. We got him straight into hospital and imaging showed cancer, with a tumor pressing onto his spinal column. Although he started treatment and steroids that day, by then it was too late. He lost the ability to walk and died a few months later from the cancer. It was enormously sad and frustrating, as that constellation of symptoms would have raised an immediate red flag with anyone with medical training. Had he come in months earlier, maybe his prognosis would have been quite different. This 20s guy came into the hospital. He had a lot of conditions where he wouldn't make it past 40 and he currently had some infection. We kept giving him antibiotics which helped, but not as much as we would have liked. After about a week of being in the hospital, I walk in and I'm talking to him and he tells me that he got a medically necessary circumcision on his last admission to the hospital. I ask if it's okay if I take a look to make sure it's healing okay. It was black with all kinds of infection. I'm just not sure how a 20s married man, or his wife, never thought to tell anyone about this for the past week. Had a patient come into the ER with some sort of spider bug bite on her hand that had progressed to a red line running up her arm. She stated she put Benadryl cream on and it was very itchy. We continued talking and I asked if she had any allergies. Yes, Benadryl. I thought, good lord, WTF, and I'm sure it was reflected on my face. We washed the Benadryl cream off her arm and miraculously it stopped itching. I had to take out the remainder of this guy's teeth. He was in his 60s and told us verbally and on his health history that he didn't take any meds. So I took out his last 8 teeth, all easy extractions due to infections and periodontal disease. But I couldn't get him to stop bleeding. I asked him again if he was taking anything. I finally got the clot stabilized, but it's almost an hour and I had to consult our oral surgeon. When he saw the oral surgeon a few months later about placing implants, he told the oral surgeon he was on BP medication and blood thinners. I refused to see him anymore after that. I was an internal medicine resident who had a patient come to my clinic for persistent flu. I had never seen her before, and she was a healthy appearing woman in her 60s. About a month before seeing me, she was seen by her PCP with persistent coughing, and otherwise had no shortness of breath or other infectious symptoms. Just a dry cough. She got tested for flu and was negative, but Tamiflu just in case it was a false negative. She had a chest x-ray which was normal. She came to me a month later because her cough persisted despite completing her therapy. Everything sounded great. Heart, lungs, everything. To be honest, I don't usually do this, but something in my gut told me to feel for lymph nodes. I felt around and found something above her left clavicle. It was hard, round, and she was completely unaware of it. I told her it was probably a reactive lymph node, but just in case, I wanted to get an ultrasound. This cascaded into her getting a biopsy, which showed squamous cell lung cancer. A CT scan showed stage IV lung cancer, not seen on her chest x-ray. All diagnosed because of a lymph node that almost by chance I was lucky enough to find by being thorough. I checked her chart about a year ago, and she's doing well. She got therapy and was in remission after a very long road and many obstacles. I'll never forget her or her case. I once checked on a guy and asked him if he'd had any previous surgery. No, never. When I examined him, he had a surgical scar from just above his pubic bone to just below the sternum. What's that then, I asked. He stared down at it and said, I've never noticed that before. WTF. My anxiety attacks are less frequent since I started on the new medication and moved into my new place. It's much larger than my old place. The bathroom where my dad would rape me was so small. So, claustrophobia and anxiety and, alright, give me a second to unpack this mother payload you just dropped like a bomb into the space between us. Final edit. I can't revisit this comment anymore. I'm sorry. If you need help, I am here for you and will do what I can. Responding to comments today brought back too many emotions and I need to check them here and leave them be. The memory is not a good memory in my mind. It does nothing but upset me. Apologies to anyone who posts and doesn't get a response past this point. I'll probably delete it after a time when I'm confident enough that it isn't a window for those who need help to crawl through. We have to feel your pain to understand it, and this one hurt badly. I've endured it again for the day, but I must quit it before it guts me again. As a patient, but this is too fresh not to share. I'm 32 and at work Friday morning, as in 2 days ago, I started having pain in my lower molars around 10:40 am. It eventually got so bad I left work and went to urgent care, noon. I thought it was a gum infection and I'd get some antibiotics and ibuprofen and be told to see a dentist or something. I had to keep apologizing to the intake person because I was stumbling over my words and focus because of pain. When the urgent care doc came in, 1 p.m., she talked to me for about 30 seconds before peeping in my mouth and saying my gums were fine, then checking my eyes with a flashlight and calling an ambulance. By the time I got to the hospital, 2ish, I was basically nonverbal and my attempts at texting had become disjointed. My spouse met me in the ER after a CT scan and helped me consent to an IV clot buster, TPA, at about 3 p.m. I'd had a stroke. For those doing the timeline math at home, yikes. Good news, the TPA worked very fast and I'm hopefully getting discharged tonight. I owe that urgent care doc a thank you note. Emergency radiologist here. I see plenty of people presenting with understated symptoms that turn out to be mind-blowing advanced disease. The saddest one was probably the 4-year-old boy who presented with a rigid abdomen for a few months. Was told by their pediatrician it was constipation months ago but his parents never followed up when it didn't resolve. When I imaged his abdomen I found his entire liver was replaced with a mass consistent with hepatoblastoma. I asked the parents why they waited so long to work it up. They said they were satisfied with the diagnosis of constipation. That one left a mark on my soul. Intercepted a young woman who was just hit by a car. Her boyfriend was standing with her freaking out. I do a basic physical exam and get a history, and make her comfortable as we wait for the ambulance to arrive. Once the ambulance arrives they ask for the same information. Except this time the boyfriend mentions he was the one who was actually hit by the car and was shielding his girlfriend's body. The entire car's windshield was cracked by the impact at his back. He was just freaking out and worried about her, was in shock and hadn't begun to feel any pain yet. While pregnant with me, my mom was wrapping up an OB appointment. The djinn had already left the room. Mom was gathering herself to leave and mentioned to the nurse her contacts were messing with her. She had spots in her vision. The nurse stopped and asked her to sit down. Brought back in the djinn, who had her stay and deliver me via emergency C-section. Without anyone knowing it, she had spontaneously developed preeclampsia and her blood pressure was rocketing sky high. She was dangerously close to having a seizure, and that would have been that if she hadn't mentioned the spots in her vision and just left as the appointment was over. The nurse didn't listen. Quite common in Malaysia since some health products escape notice from the government. I don't think this is important, but have you been taking supplements for weight loss or do you have an exam coming up? Young women coming in with severe palpitations and crazy arrhythmias. Usually healthy, no prior health issues and or usually at the age where they're in college or university. Initially most people would be thinking thyroid issues and a fair few have been treated this way. Then I realized they've been taking caffeine supplements to help with weight loss, increase concentration. Specifically some brands off-label only put it in between the fine print of the product ingredients. Usually in near lethal quantities lol.